Thank you for joining this lecture today. I am going to be discussing some of the main principles of conducting systematic reviews of the literature, considering the importance of accessing reliable, accurate information when making decisions on how we provide evidence-based dental care for our patients and advice to the community. Here I have listed the learning outcomes for this lecture. At the end of the lecture, you should be able to describe the purpose of systematic reviews to support delivering evidence-based dentistry and define different types of the studies. The main focus of the lecture will be on the importance of being clear in specifying the research or clinical question that you want to ask, with the learning outcome of understanding why that is important. The ask aspect of reducing systematic reviews. The next section will describe how to source the evidence to answer clinical and research questions, accessing the literature. Finally, there will be an introduction to methods used to assess the design, conduct, and results of studies using systematic methods. In undertaking the care of our patients, we want to choose treatments that work best. But what are these? What is the evidence base on which we make these decisions? While we are students, we are learning from our teachers, and as we do so, new studies are being conducted and reported. There are many clinical studies, but there used to be no organised way of bringing the findings together. A movement began to address this first within medicine that was clinically driven, to develop evidence-based medicine, not simply doing what we've always done, but critically looking at treatments and procedures to understand what would be best for our patients. An important driver of this initiative has been addressing the increasing cost of providing medical care. Are all the procedures we do beneficial? There are often inefficiencies. A turning point came with the publication by Archie Cochrane in 1971, looking at inefficiencies in health services, delivering ineffective care, and the importance of undertaking randomised clinical trials which provide a rigorous method to identify best treatments. In these trials, existing or new treatments are compared under standardised conditions, with each person joining a study having an equal chance of being allocated to the new or standard treatment, with the aim of providing an independent estimate of effect of benefit. Many clinical trials were published. The research on treatments was being undertaken, but there was no way to join the information together in a consistent way. An important collaboration began in the 1980s to develop systematic methods of joining together the results of clinical trials, seeking to answer similar clinical questions. The groups doing this work developed a collaboration worldwide, and it was named the Cochrane Collaboration in memory of Archie Cochrane. These volunteer groups of clinicians and scientists undertake systematic reviews of randomised controlled trials using the same systematic method to bring the information together. The results are published so that more evidence-based treatments can be selected, and we get to know what will benefit our patients best. There is a worldwide Cochrane collaboration for oral health, and it is based in the UK. A simple description of using evidence-based dentistry is doing the right things right. As you can see here on the slide, this means delivering the right treatment to the right patient at the right time, using the right persons or people in the right setting with the right patient experience. Evidence-based medicine is defined as the ability to track down, critically appraise for its validity and usefulness, and incorporate a rapidly growing body of evidence into clinical practice. Why do we need to have systematic methods of looking at the results of clinical studies and at health information? The first reason to consider is that there is a huge volume of information available. We know that much information in general media outside of scientific publications can be incorrect and misleading. And unfortunately, not all studies published in scientific and medical literature are accurate and valid. Secondly, when we make judgments on which clinical treatments and services to provide for our patients, it is important that we use the best available evidence from trusted sources. So not what we can find on social media or through a quick Google search or Wikipedia. Before we consider systematic ways of looking at medical and dental studies, we need to consider that not all information available is of equal value in terms of its ability to contribute to the strength of evidence as to whether a treatment or procedure will work well for our patients. There are many different types of studies and types of information. This pyramid diagram describes visually one of the classifications of different types of studies, providing what is called a hierarchy of evidence. At the top of the pyramid are study designs most likely to provide the strongest evidence, and at the base of the pyramid, what may be described as studies that produce the lowest strength evidence. Let's look at this in more detail. At the lowest level is expert opinion, editorials and commentary. This is rated low because it depends on individuals' own opinions, and these may not be based on recent scientific studies. They may be out of date. They may simply reflect people's own beliefs about how procedures or materials work for them. They may say, this is the way to do this, we've always done it this way. The next level is descriptive case reports or case series. They may be accurate for that individual patient, but that may not be the usual case. And these cases are often published because they are unusual or odd, not a good basis to make clinical decisions for other patients. Case control studies are study designs when we're trying to understand the underlying difference between one group of people, patients, who present with a condition called cases, and you match these with same-age people who are similar but who do not have the condition, and we look for the source of differences and set up reasons, hypotheses to test in future studies. So again, these are descriptive studies. Cohort studies follow one or more groups of people over time, often to understand the natural history of conditions. These are again observational studies. The final group of studies towards the top of the pyramid are intervention studies, where we are comparing one or more treatments with each other or with the usual care we provide. If these studies are designed so that patients are recruited who have similar characteristics, for example the same age, same starting conditions, and have an equal chance of being put into the group having the new test treatment or the control or usual treatment, these are randomized controlled trials. After the intervention, we follow up these groups over the same period of time and measure the clinical results. Once the study is published, we're able to compare the results of this trial with other similar ones within a systematic review and combine the results. This method of combining is called a meta-analysis. This will give us an average measure of health benefits for the new treatment or procedure, providing the highest level of evidence. The analysis of studies described in the last slide helps us to identify and classify the best evidence research by an analysis of published papers in a systematic format. When evidence-based medicine began, this was seen as the only measure that should be considered. However, it became clear that two other areas are important, and these are shown in this diagram. At the top right, you can see that including opinion from clinical expertise is important. It is too simplistic to list this as the lowest level of evidence. Good clinicians get to know what works for their patients, what's possible, and clinical judgment is of value and should be considered. The third area that you cannot get from a meta-analysis of clinical trials is patients' values and preferences. So we may know from a systematic review of the literature what is the best way to undertake, for example, endodontic treatment. In a molar tooth, the best materials. But if patients prefer to have an extraction and don't want the expense and bother of complex endodontics, then this will become the most important consideration. Therefore, over time, it has been recognised that evidence-based medicine and evidence-based dentistry is a combination of reviewing the best research evidence available with a recognition of clinical expertise and patient preference. The most important first step of undertaking a systematic review of the research evidence available worldwide is to have a clear question for which you wish to review evidence of effectiveness. As this is the most important, we're going to spend the next few slides looking at this and showing how it will set you up best for your review. As noted in the slide, a focused, specific question is more likely to enable you to undertake efficient searches of databases and give you relevant answers. So you begin with a general clinical question that may have arisen in your work, and you're wondering what's the best treatment I can provide in a particular circumstance for my patients. To help you structure your question, a question format like PICO is often used. As you can see here, PICO stands for P, patient or populational problem, I for intervention, C for comparator or control, and O for outcome. Let's have a look at a practical example to help this process make sense. This slide begins to provide an example of developing specificity into a clinical question. Here you can see a typical clinical question you may ask. Is it worthwhile to place a fissure sealant for my patients? This is a general question which can easily arise in conversation with clinical colleagues. If we want to move forward and undertake a systematic review of the literature, of the research papers that would help us to answer that question, we need to change the general question into a specific focus question. What does this mean? Let's take a look. I have highlighted in red the words we need to consider. Worthwhile. How will we measure that? Are we talking about preventing future dental caries? We may be talking about the question from a policy perspective. For example, if you are running a dental clinic, is it more cost effective for all the dental nurses in my clinic to provide fissure sealants for children, or wait to treat caries till it develops? What type of fissure sealant are we interested in? Should they be only resin-based? What about glass ionomer as fissure sealant? This may cost less to provide, but is it as effective as resin-based sealants? My patients. Are we talking about children only? Am I working in a high caries risk area or low caries risk area? This will change the value of placing sealants if it is a cost-effective way to prevent future caries. However, if the profile of child patients in my practice are very low caries risk, providing sealants may be an unnecessary extra cost. One method to help you structure a question is to use the question format like PICO. Let's have a look at this in the next slide. Here we're looking at structuring the clinical question into a research question. The P of PICO stands for patient or population or problem. So this allows us to put more details into this part. How would I describe this group of patients? By their age, health status, particular characteristics. Here you need to ensure a balance between being very precise and over-limiting the search. So in this example about fissure sealants, our focus will be about children, perhaps with erupting teeth. The I in PICO stands for intervention. In the clinical question, we have talked about place a fissure sealant. As discussed, do we need to know about the effectiveness of different types of sealant? Now this will depend on how many studies are available in the literature. An advantage of keeping it broad to describing the intervention as a fissure sealant is that once we have identified all the papers, if there are sufficient, we can look at specific ones within the review and compare to others. In this example, this broad term will include both resin-based and glass ionomers, and we can compare them with a single search. The C in PICO is the comparator or control. We should consider what is the alternative to placing a sealant. It may be that we do not provide any treatment on that tooth, which would be classed as no prevention, or maybe we wait till caries develops and then provide a filling. This would be described as usual care. Both may be included in your review. The O in PICO is outcome. In the informal question, we have said, is it worthwhile? We need to specify how we will measure that. We need to consider what outcome is relevant or important to us. As a clinician, we probably want to know how can we prevent caries if we place fissure sealants for all our child patients. Let's now compare our original question on the left with the same question using the structured PICO format shown on the right. On the left we asked, is it worthwhile to place fissure sealant for my patients? On the right you can see the question is longer. It has added specificity to each area. Also included in brackets more detail. Depending on the search, you may exclude these additional areas from your search terms, but include them in your analysis of the papers identified. Let's read the question with and without these additional areas. First, without. Do children who have a fissure sealant placed on permanent molar teeth develop less dentinal caries than children who do not have a fissure sealant? Then with further details, do children who have a glass ionomer fissure sealant placed on the occlusal surface of first permanent molar teeth develop less dentinal caries than children who do not have a sealant? It's advised that you seek help with formatting PICO questions. The reason why it is important to do this as well as possible is that the question sets the inclusion and exclusion criteria from which you will select evidence, research papers to answer that question. Your supervisor will help, and many librarians in medical libraries have additional training in undertaking systematic reviews of the literature. Now there is also excellent support online, notably from the University of Oxford Centre for Evidence-Based Medicine, and I've added that reference at the end of the lecture. Now we've considered how to structure questions to be efficient in seeking the right research evidence, let's consider methods for sourcing that evidence to answer your research or clinical question. This is stage 2 of undertaking a systematic review and is titled Access. As undergraduates, places you will be most used to accessing dental information from will be experts, your own tutors and textbooks. While there these are important, there will be limits. Clinicians often specialise, and then they know most about clinical questions that relate to their specialty, and it really is not possible to be up to date in all specialised areas. Textbooks, by definition, are out of date of the most recent literature. Therefore, the most consistent source is electronic databases. These are updated continuously and are structured to be searchable using specific search terms. Some of the most common electronic databases relevant when looking for research that provides healthcare evidence are the Cochrane Library. This will have detailed records of clinical trials in many clinical areas. Individual papers can be found in the United States National Library of Medicine and can be searched using PubMed. Embase is the European equivalent, and PsycInfo will have more papers relating to the behavioural sciences. You've structured your question. You now need to develop a search plan so you can cover all the relevant literature. There are 4 main steps for this stage: choosing your search terms, combining those terms, and choosing which electronic sources you will include. As you go into the detailed search, which we won't be covering today, you would need to specify search limits, and these could include, for example, years of publication or language of publications. Let's look at the first stage of choosing your search terms. This is where you begin to see the benefit of using a PICO format to restructure your clinical question, because the PICO words become your search terms. This slide gives you the practical example of how to use your PICO question to form search terms. Let's think about your population, shown in the left-hand columns. We started with your patients and decided we wanted to look at children. In some papers, older children could be called young people. So by adding this term into your search, you may find additional papers. To add this, you use the word or. Similarly, for the intervention, we stated fissure sealant. You will add papers to your search if you also include other terms for fissure sealant, like just the word sealant on its own, or resin sealant, or glass ionomer. So each time you add a search term, you will add papers to your search. As you can see, I've added other search terms by using the joining word or for the comparator treatment and for the outcome. So the first comparator treatment is usual care, or filling, or restoration, or amalgam. For outcome, we start with dentinal caries, or dental caries, or decayed teeth, or carious lesions. There may be other search terms you want to add in each category. These are just examples. After running searches using the initial terms, you will need to combine searches. This has the opposite effect to your search. Instead of adding papers, it will reduce the total number. So reading from left to right, to be included in your search results, not only does the paper have to be about children, it needs to be about fissure sealants and usual care and dentinal caries, or any of the combinations. Running the initial searches and adding in the combining terms is likely to reduce the papers you identify from many thousands to a few hundred. These have to be screened for relevance, and the first level of screening is title and abstract, to ensure the paper includes the parameters you want to look at. The final stages will relate to assessing the quality of the papers and determining whether the results can be combined for numerical analysis. Having covered the principal stages of searching, let's consider what electronic sources you should be looking at. There are two broad classifications: primary and secondary sources. Primary sources are databases that include the original scientific article, the paper with the full method and results of any study. Secondary sources are databases and websites of trusted public agencies, professional bodies and journals that focus on systematic reviews, national and international guidelines for providing care, and evidence-based summaries. It's very important at the undergraduate stage to begin with secondary sources. In these sources, professionals have done all the hard work of systematically searching the literature on key clinical topics. They have synthesized that evidence and drawn valid conclusions and often produce guidelines as to the best type of clinical care to provide. It is important to use these first and not do a search on Google or Wikipedia or social media, but go to valid, trusted sources. Most undergraduates will be searching in secondary sources unless they are involved in a separate research project. Where evidence has not already been synthesized on a topic, a new systematic review of primary sources may be needed. In this slide, I have listed some of the key secondary sources that will provide you with clinical information that has reviewed existing research evidence. These sources should be freely available to you. The Cochrane Library is the leading source of high-quality systematic reviews of randomised controlled trials. However, it does not include studies which are not randomised controlled trials, so some topic areas will be missing. Clinical guidelines are published by a range of bodies, and I have listed leading UK ones: NICE, the National Institute of Health and Clinical Excellence, SIGN, and the National Guidelines Clearinghouse. Specialist organisations have published guidelines like the American Association of Paediatric Dentistry. There are international journals including evidence-based dentistry. As noted, many clinical questions have been examined systematically, and there is a requirement to update these reviews every few years as more studies become available. However, sometimes the clinical question has not been reviewed, and if the answer is not available in trusted secondary sources, then primary sources need to be searched systematically using the principles underlying examples of the methods that I have described. Key primary sources are Medline and Embase. As I noted earlier, the US National Library of Medicine provides the bibliographic database Medline, and it is the one most widely used to identify and retrieve evidence, individual scientific studies and systematic reviews. It can be searched via the PubMed interface or Ovid. Embase is the European equivalent as a major primary source in medicine, dentistry and drug research. In undertaking a search of papers from primary sources, once identified, the next stage is appraising the papers, the evidence, assessing its quality. This process is called critical appraisal. It is important because some published studies have serious flaws in study design, conduct, analysis, or reporting. All of these can affect whether accurate conclusions can be drawn, determining the validity of the work. So when reading a scientific paper, you should avoid just reading the abstract alone with the conclusions, because sometimes the study may be based on insufficient numbers of people, the methods used may not have been standardised, there may be inadequate measurement of outcomes, the statistical, the mathematical analysis of the data may contain errors. You would expect that all these factors should be picked up by the journal in the reviewing process. However, we know that is not the case. So just because a paper is published in a journal, it does not mean it is without errors. In addition, it's important to recognise that the population in which the studies have been conducted may be so different from your own that the results obtained on that study population may not be obtainable on your own group of similar aged patients. The skill of appraising papers, assessing the published research evidence, takes some time to acquire, but there are very helpful tools that have been published that give you structured step-by-step guides as to how to do this, what to look for in each section of the paper, and at the paper overall. One example of these are CASP tools, developed and published by the Critical Appraisal Skills Programme, again freely available. CASP tools provide a structured checklist to assess different types of studies. Several are available, one for systematic reviews, for randomised controlled trials, for cohort studies, case control studies, diagnostic studies and qualitative studies. The first step is to read the whole paper and then to answer the series of questions within the CASP tool for that study type. CASP tools have 10 to 12 questions depending on the study type, and these are in 3 or 4 broad sections. Section A questions are determining whether the results of the study are valid. Section B seeks to identify whether the study is methodologically sound. Section C assesses the results of the study, while Section D assesses the question, will the results help you locally in your country, area of study, patient base? Let's consider an example of the CASP list for appraising a randomised controlled trial. The first 3 questions that make Section A are screening questions about the validity of the basic study design and can be answered quickly. Question 1 is, did the study address a clearly focused question in terms of picostructure, specific population, intervention, comparator and outcomes measured? The second question in Section A is whether assignment of participants to the interventions was randomised. That is, did they have an equal chance of being assigned to the test group as to the control group? This reduces the chance of bias, where an investigator might choose to give one patient the intervention, like a fissure sealant, rather than put that participant in the control group. Therefore, this section assesses whether that choice was made independently of the investigator. The third question is, were all the participants who entered the study accounted for at the end? This is also very important. For example, if the study was conducted over 2 to 3 years, we would expect some patients not to return for assessment, to leave the area or move away. But the essential aspect is that each one is accounted for, so we know if people are missing from the final analysis and why. Questions in Section B look at methods used. For example, did the participants know which group they had been assigned to, which is called being blind to study group? Were the investigators also blind to study group? This is achieved in drug trials by giving a dummy or placebo drug which looks and tastes the same as the test one. This may not be possible for studies comparing different dental materials. Section C examines the results and looks at how many people took part, were there enough participants, how accurate is the measurement of outcomes, and the benefits, did they outweigh any harms or costs? That gives a flavour of the types of questions within a CASP tool when assessing the quality of a paper. In this next slide, I have summarised the detail of the topics covered in the lecture. We've considered important principles in conducting systematic reviews of the literature, why we do them, that there are different types of studies and information that contribute. We've spent time considering how to structure a question that will enable you to conduct a search of the literature efficiently and systematically. We've described primary and secondary sources of the evidence and how to access them. In the final steps, we've introduced you to appraisal, assessing design, conduct and results of individual studies. Many systematic reviews are already published and have been incorporated into clinical guidelines. It is essential to use trusted sources. I would expect that at the undergraduate level you would be using secondary sources rather than undertaking your own systematic reviews independently. In preparing this lecture, I would like to acknowledge the material shared from the Masters in Dental Public Health at Queen Mary, University of London. Finally, for those who would like to follow up the example we looked at about fissure sealants, I'm pleased to say that there is already a systematic review available that will give you the answers, and it is in the Cochrane Library. Here are some useful references and guides. The Centre for Evidence-Based Medicine and the Bodleian Healthcare Libraries at the University of Oxford have published practical tutorials about the steps for undertaking systematic reviews. Finally, I'd like to thank you for your attention to this lecture, Introducing Systematic Reviews. As the lecture is recorded, you can revisit any part and see the references and useful sites listed at different points in the lecture. Thank you.